Hi guys, my name is Bullis. I am a physical therapist and I am making this video to share with you my story, my why, and my purpose, kind of in hopes of inspiring others and all those who face similar obstacles and challenges as I did during my pursuit of my career in physical therapy and in healthcare. So I'll give you my little introduction into medicine. So my mother, she was a physical therapist, and my father, unfortunately, was born with a genetic cartilage disease, very degenerative in nature. So throughout the course of my growing up, I witnessed dozens of hip surgeries, knee surgeries, ankle fusions, you name it, he's had it done. So watching my mother basically take care of him with ADLs, with his rehab, so that was my first introduction into healthcare, was watching the surgeries and then watching my mom's rehab and helping him recover. So that being said, I decided to follow in her footsteps and attend Misericordia University for my undergraduate in psychology, with plans to then further pursue my doctorate in physical therapy. Unfortunately, after getting my bachelor's in 2011, my father had a large brain aneurysm measuring almost 1.5 centimeters in length, requiring 14 coils for closure. We almost lost him. It was scary, it was tough. And that was during the first semester of PT school. So I made the decision to withdraw from school. I went home, was working full time just to kind of provide for my family, with whatever support, and just be home, not to be away at school. And after 2 years of rehab and recovery, I was able to re-enroll back at PT school in 2013 to continue my journey and to get back into what I started with a renewed determination and focus for what really matters, and that's becoming a therapist that families can count on, to depend on, they can communicate with effectively and be comfortable with. And that's what's really helped me throughout my father's recovery, and that's what I want to be able to give to other people, other patients, other families. But unfortunately, I was not able to receive my financial aid when I went back in 2013. I'm currently working 3 jobs. My full-time job as a physical therapist at Meadow Springs Center in Plymouth Meeting, Pennsylvania. It is a post-acute setting, inpatient facility with trach and vent patients only. We specialize in traumatic brain injury and spinal cord injury rehab. Anyway, after a full day at work at my facility, I then switched gears to go to my second job, which is home care physical therapy on a PRM basis. Typically, I see 1 to 2 patients each evening, Monday through Friday. In the afternoons, mostly ortho-based patients for my home care job. And then following home care, we switch gears again and we go to job number 3, in which I am a club level soccer coach in the Philadelphia area for a U8 boys team and a U16 girls team. So when I get to work, my work day starts around 7 a.m. I'll come in, I get my schedule. I'll see anywhere from 10 to 14 patients for treatments a day, and then that depends on if we have any new admissions that need evaluations. Treatment base ranges from gait training to balance training to ADLs to power chair mobility to splinting and contracture management and patient education. My goal and the impact that I try to make every day in healthcare is to be the most compassionate, thoughtful, thorough care provider that I know my patients need, my coworkers expect of me, and that their families also need. Because at one time, my family and I were right in those same shoes with them, in the seats, sitting next to the doctors and the therapists, kind of wondering what tomorrow will bring. And that sense of hope and comfort is what I really strive to bring to patients and their families. So over the next couple years, my plan is to eventually move into a lead therapy role position, and then to become a director of rehab and be able to further promote the culture of teamwork and compassion and hard work in the subacute setting that is pivotal and vital for patient outcomes and for them to reach the goals that they want to reach, which is ultimately to return to home with family. And it's one thing that I always tell my patients and my players, and it was advice from my father that said, keep your head up, keep moving forward. And it's to basically focus on the opportunity and not the obstacle, and to always kind of keep trying to do your best and keep pushing yourself. And this is Dad right here. He's got the Misericordia University shirt on, always my biggest supporter, and I'm his as well.